Later.
Okay. Okay. Well, I'm Brian Hammons. I'm from Express Scripts. And I'm here to talk about the pharmacy benefit overview for University of Texas. So today we'll discuss the pharmacy benefit that's available to you, helpful information, common definitions, and then resources that are available, including the Express Scripts mobile app. So the UT benefit is managed by Express Scripts. Medication from the Express Scripts pharmacy can be delivered to your door. There's access to pharmacists 24 hours a day, 7 days a week, and you can manage your prescriptions anytime and anywhere with the Express Scripts app. Your member ID card, of course, includes some important information. Most importantly, your customer service telephone number for Express Scripts. And then also you are able to access your card electronically if you prefer not to carry the manual card. Vaccinations, many vaccinations are covered by the prescription plan at a participating retail pharmacy at no charge. Of course, ask your pharmacist which vaccines are right for you to learn more. And of course, don't forget to present your member ID card to the pharmacist, because like I said, with that card and with your benefits, many of the vaccinations will be at no cost. For patients who have chronic and complex health conditions, Accredo is our specialty pharmacy. With Accredo, there's pharmacists and nurses available. They work in an area called a therapeutic resource center. What that means is all these pharmacists and nurses are specially trained for these complex conditions. So for example, rheumatoid arthritis. If you have rheumatoid arthritis and you take a drug like Enbrel or Humira, the pharmacists and nurses that work at Accredo, we have a group that are specially trained just in rheumatoid arthritis. They'll deal with those patients all day, so you get the very best care available there. Long-term medications, there's two different ways to get a 3-month supply. One is through the Express Scripts pharmacy. With the Express Scripts pharmacy, they are delivered to your door with free standard shipping. You can ask your doctor to submit those prescriptions to us. Most of the time that's done electronically. There are auto refills and refill reminders available. And again, you have access to a pharmacist 24/7. If you'd rather go to a local pharmacy, Walgreens is also authorized to dispense medications in a 3-month supply. They've got over 9,500 locations nationwide. And again, with at Walgreens, you can use their mobile app or in-store to transfer prescriptions. They also have auto refills and refill reminders. So for 2023, 2024, there's not going to be any change in the copays. As a reminder, the deductible, which is $200 per person, resets on September the 1st. That is a combined pharmacy and medical deductible. So after your first $200 spent out of pocket, whether that be through medical or RX, then your pharmacy copays would kick in, and they are listed there. And again, there is no change for this next plan year on the copays. Some definitions and information. Of course, there's a list of drugs that are covered. That list is routinely reviewed by a panel independent of UT or Express Scripts of physicians and pharmacists. Of course, on there are brand and generic medications. And of course, we encourage you to talk to your doctor about seeing if a generic is available for you. On generic prescriptions, 9 out of 10 prescriptions filled in the United States are for generics. We just encourage you to review your medications regularly with your doctor or pharmacy and ask if there is a generic available for that. You can also use the Express Scripts mobile app or go to the website to find a generic order price of medication. Some medications require a little more information from the physician's office before they are allowed for coverage. This is called prior authorization. It makes sure that the prescription is suitable for the intended use. Again, it just means that more information is needed to see if your plan covers the medication. And to get the prior authorization started, if you're at a retail pharmacy, usually the pharmacist there is going to contact the doctor's office to get that going for you. Another program in place is drug quantity management, where Express Scripts will make sure you receive the quantity that's considered safe and effective by the FDA. The most cost-effective product strength is dispensed, and this helps reduce waste for the system. And then the last tool is step therapy. In this scenario, you'll typically have many medications that can be used to treat a condition. So the first step medications are usually generic and lower cost brand name medications. And we sometimes ask physicians if those can be tried before the second step medications are utilized, which are typically the higher cost brand name medications. There's just some notes on how to be a smarter pharmacy consumer. Again, I think the thing that I point out to most is just always checking to see if there's a lower cost equivalent or if there's a generic medication available for the condition that you're being treated for. And then resources, again, the customer service phone number is on the back of your member ID card. That's available 24/7, whether you just have general questions or if you have a clinical question, we have pharmacists available. The Express Scripts mobile app, of course, you can download that for free. If you already have access to the Express Scripts website, when you download the app, the username and the password will be the same for the app or vice versa. Home delivery prescription information is available on there. You can price the medication. And you can also locate a pharmacy that's near you that is in the network. As I pointed out earlier, also, you can access your member ID card virtually on the app. And then, of course, expressscripts.com, basically the same information that you would see on the app is available on the website. Finally, if you go to express-scripts.com /UT select, you'll actually find some more specific information on there about the UT pharmacy benefit plan. Absolutely. Okay. And that's the presentation. Any questions? Let's see any on here.
I actually have a question. In the earlier presentation, they said Wegovy was not going to be covered anymore by Express Scripts. Would do a prior authorization.
Well, Wegovy does require, for most plans, Wegovy does require a prior authorization. And that was one of the things that I'd spoken to earlier on some of these medications, particularly the ones that are a little higher in price. They ask for some additional information from the physician's office before they will determine if they'll cover the prescription.
Because it's not just because it's a weight loss medication.
No,
it's required in an existing condition, and it's still covered.
Exactly.
You have a question?
Oh, there is a question. What's the difference between first step and second step? So let's say you're being treated for hypertension. And there's at least 20 medications that can be used for hypertension, and the physician writes for a brand name medication for hypertension that is very expensive. If you're first starting out on the medication, we will ask the physician's office if a lower cost brand or a generic medication might be appropriate versus the higher cost brand medication. And so doctor may say, no, this specifically is the medication that he or she wants you on. But we will, in some cases, we will always ask to see if the lower cost medication can be used. Same medication costs different prices during the fiscal year. Is that because of copay? The copay is a flat, the UT copay is a flat copay. So I'm not sure why the cost would vary. The copay doesn't vary throughout the year. It's a flat dollar amount. Sometimes you will have insurers that have a copay that's a percentage. And so when it's a percentage copay, yes, absolutely. The cost can vary throughout the year, but the UT copays are a flat, what we call a flat dollar copay. They're a set amount. So we should see very little to no variance unless the amount, I guess I would say unless the amount of the medication is less than the copay. So let's say the copay is $20 and the medication is $10.50. And then the next time it was $12. Well, it's still below the $20 copay. So that's the only scenario where I could see that there would be a variation in the copay. Okay. Other questions? See any more right now? Okay. Thank you.
Thank you.
Accredo is available through where? Accredo is the specialty pharmacy, so Accredo is available through your UT benefits. So if you call customer service and you tell them you need to talk to Accredo, they will put you over to the Accredo folks so that you can speak with them. So I'd say call the customer service number, and tell them you need to talk to Accredo.
Where's the customer service number?
I don't know if we put it in there or not. No, we go back to keep going back and go back to it's on that card. So you'll have a card that looks like that, and patient customer service, that's the phone. Those numbers are specific. I have no medications are more expensive, such as Walmart, would prices be better at Walgreens. They might be. To me, that's one of the really great things that the Express Scripts mobile app will let you do. You can type in the name of the antibiotic and how many you're getting. And then based on where you are, you can, it will price out the antibiotic at all the pharmacies near you. So yeah, there can be some variations on antibiotics. I'd say I'd encourage you to register, if for nothing else, register for the app for that, because you can price those medications out at the network pharmacies that near where you're located.
Is there any other questions? If not, we'll go ahead and end the session for Express Scripts. Thank you so much for attending. All right. Thank you, everyone.
Thanks.